A title page features the U.S. Department of Health and Human Services logo. Now a welcome page highlights the second of 3 session titles.
Thank you for joining our session, Key Roles in Implementing a Certified Complete Electronic Health Record, or EHR. This is part of a series of education modules that provide information and guidance around health information technology, or health IT. The other session titles are What is Health Information Technology in Meaningful Use? And Maintenance and Optimization of the Certified Complete Electronic Health Record. This module has been developed as an orientation for health IT staff working in safety net healthcare settings, such as community health centers, federally qualified health centers, and freestanding clinics. These modules are designed for use in a variety of settings. In an organization that is already live on an EHR, these modules can enhance the new employee orientation process. Alternately, this session could serve as an orientation module for a team that is embarking on their EHR implementation. Finally, health centers focusing on the CMS Meaningful Use Incentive Program would also benefit from this module.
A heading, Pre-Module Questions.
These questions were created to test your knowledge of the concepts before they're presented. The screen will flash first with questions and will give you a couple of moments to jot your answers down. You'll be able to check if your answers are correct. Thank you for taking the time to answer these pre-module questions. Question 1. Which of the following are reasons why we should implement the Certified Complete Electronic Health Record? A. Improving quality. B. Ensuring safety. C. Improving efficiency. Or D. All of the above. Question 2. An implementation specialist is a healthcare professional that processes insurance claims. A. True or B. False. Question 3. Implementation of a certified complete electronic health record can be done quickly with a few steps in the process, and one person is needed for this initiative. A. True or B. False. Question 4. If you use a stoplight approach for managing a task plan, what do the following mean? Green, yellow, and red. Question 5. Talking about change and change management are important during a certified complete electronic health record implementation. True or false? Question 6. The term future shock refers to the psychiatric treatment known as electroshock therapy. True or false? Question 7. The term preloading means taking certain elements from the paper chart and manually keying them into the certified complete electronic health record so the information is readily available. True or false? Question 8. Health centers may experience resistance to implementing the Certified Complete Electronic Health Record. Which of the following are types of resistance? Select all that apply. A. Individual, B. Cultural, and C. Community. Question 9. Reengineering workflows means reviewing the current paper processes and designing them for the Certified Complete Electronic Health Record. A. True or B. False. And question 10. Match the key words to their definition. 1. Sponsor, 2. Target, and 3. Advocate. And the definitions are A. An individual or group being impacted by the change. B. Individual or group who wants the change to occur and does not have the organizational power to legitimize it. And C. The individual or group who has the organizational power to legitimize the change. Now let's review the answers to the pre-module questions. Question 1. Which of the following are reasons why we should implement the Certified Complete Electronic Health Record? The answer is D, all of the above. Question 2. An implementation specialist is a healthcare professional that processes insurance claims. That answer is B, false. An implementation specialist is a professional that assists you on major tasks as you near your go-live date as a health center. This person may be from a health center controlled network, work for an HIT vendor, or even be a consultant. Question 3. implementation of a certified complete electronic health record can be done quickly with just few steps in the process, and one person is needed for this initiative. That answer is B, false. The implementation process may take several months, has many steps in the process, and should be done with the work of a team. Question 4. If you use a stoplight approach for managing the task plan, what do the following mean? Green means a task has been completed on time, yellow means a task is close to being overdue, and red, a task is delayed. Question 5. Talking about change and change management are important during the Certified Complete Electronic Health Record implementation, and that answer is A, true. Question 6. The term future shock refers to the psychiatric treatment known as electroshock therapy. That answer is false. Future shock is a condition in which an individual can no longer cope with changes and they fail to incorporate new changes in a functional way. Question 7. The term preloading means taking certain elements from the paper chart and manually keying them into the certified complete electronic health record so the information is readily available. That answer is A, true. Question 8. Health centers may experience resistance to implementing the certified complete electronic health record. Which of the following are types of resistance? Select all that apply. It is A, individual, and B, cultural. And question 9. Re-engineering workflows means reviewing the current paper processes and designing them for the certified complete electronic health record. And that answer is A, true.
Arrows connect keywords to definitions.
And now, let's move to match the keywords to their definition. A sponsor is C, an individual or group who has the organizational power to legitimize the change. A target is A, an individual or group being impacted by the change. And an advocate is B, an individual or group who wants the change to occur and does not have the organizational power to legitimize it.
A new heading, Objectives.
Putting in place or implementing a certified complete electronic health record at your health center, or going live as it's called, is one of the biggest initiatives your organization will undergo. It is important that you, as an implementation team member, have a good understanding of the following: the role of team members and what to expect, major tasks team members must complete during the implementation, the concept of change management and its importance, and the impact of implementation on quality improvement. Everyone in the health center has a role in helping us make this a successful go live. We want to do it for our patients. We want to show them that we believe in quality, security, and efficiency. Determining who will join your implementation team can be a challenging task. It is essential to involve the staff who are delivering patient care today in the design of these new systems. Your success will be greater if a clinical champion and administrative champion are identified early on. When implementing a certified complete EHR, health centers have used different team models and different approaches for project management based on available resources and in-house skills. Regional extension centers, primary care associations, and health center controlled networks are all readily available to support you on your journey through EHR implementation. For this session, let's meet some of the key players that are a vital part of the implementation process. There are many ways to have a successful EHR implementation experience. This is one example of how staffing could occur. With us today is Clauderia, the implementation specialist from your health center controlled network. She'll be working very closely with your team on major tasks as you near your go-live date. In other support models, the implementation specialist might work for an HIT vendor or even as a consultant. We have a number of staff from your community health center as well. Sandra, who has worked in the QI department until now, has been named your EHR project manager. She's in constant contact with your implementation specialist and the rest of the team to make sure all tasks are being completed on time. Dr. Harper is your provider champion. She has an interest in helping bring the voice of the clinical users to the table when making decisions that impact them directly, which makes her a really good fit as a provider champion. And Elizabeth, your health center CEO, has also joined us today. She knows it's her job to provide sponsorship and vision throughout this major implementation. It's important to have a member of the executive leadership team understand the tasks at a high level, know what's on target, and know what the barriers are to getting delayed tasks done.
A heading, Implementation Specialist, Roles.
Hi everybody, I'm Clauderia, and I am your implementation specialist for this project. Since you are a member of our Health Center Controlled Network, I was assigned to help you implement the Certified Complete EHR, and I'm ready for the task. I work with the Health Center to pull a capable and effective team together to help us make this project successful. One of the first things we decide is who will be a part of the team. Oftentimes, one person can play multiple roles on the team, so I am here to lend an extra hand. The EHR manager, who we will meet in a little while, works with representatives from the following departments. Clinical team members, such as providers, nurses, and medical assistants, tell us how they currently chart on the paper. This will help our team make decisions on how the EHR will be used to document patient care once it is implemented. IT personnel will help the organization identify connectivity issues, review the internal network, and purchase and install the necessary equipment, such as laptops or desktops, computers, scanners, and printers. The billing and front desk staff will keep us informed of what CPT codes to use. They'll learn how to retrieve charges electronically once we've gone live on the Certified Complete EHR. No more paper super bills. The Quality Improvement Department should be on the team to make sure that data for quality and utilization measures, grants, healthcare plans, and current QI initiatives can be extracted from the Certified Complete EHR. Medical record employees are an important part of the team. They will learn how to manage the chart electronically and how to scan external documents, like radiology results, into the system. Mental health staff and case management should also be represented if the health center plans on taking them up on the electronic health record. For many organizations, this may be the first time that their charts are integrated with the primary care chart as well.
A subheading, Responsibilities.
I make sure to tell all members of the group that they must attend all meetings when we discuss their roles and responsibilities, ask questions should they not understand something, represent their departments by bringing their colleagues' questions and concerns to the group, and finally, complete their homework on time. Once our team has been formed, we have a kickoff meeting to discuss the project in general, as I know this is new information for everyone. We talk about how to manage this big change at the health center, revisit our vision for quality improvement and how the EHR will help us meet it, and demonstrate the features of the EHR, as many team members may not have seen it before. As the project progresses, the team and I will review current workflows in the organization and determine how their paper processes will happen electronically. This is known as workflows re-engineering. Training is another big topic of discussion amongst the team. We work out a plan where clinical staff will first take advantage of computer-based learning modules to learn the basics of how to document patient care using their new certified EHR technology. Next, there will be a classroom-style learning session for team members to practice their new skills and workflows. And finally, we will provide support on the team in scheduled practice sessions before the big go-live. We plan training right before go-live, so users can remember what they just learned. There are some teams who request that I come on-site to the health center to help support users as they document in the system for the first time, whereas other teams develop in-house super users to provide on-the-job assistance. One thing is certain, an investment in training your staff up front will pay off in terms of productivity and quality outcomes once they are using the certified electronic health record. Implementation is the first step. Ongoing maintenance and enhancing or optimizing the use of the system becomes an activity woven into the daily work of individuals at the health center.
A color-coded spreadsheet.
In the days following the kickoff meeting, implementation team members review a task plan. One of the tools I like to use is a stoplight status approach. Green means completed on time, yellow means the task is in jeopardy for delay, and red means that the task is delayed and we need a plan to get it back on track. I will show the EHR manager how to monitor and track the team's progress on their task.
Change management.
Part of my work as an implementation specialist is to help the team learn about change management. Because implementation of an EHR is such a big transition, we have to keep change management in the front of our minds. I am an advocate for change, meaning I want the change to occur, but I don't have the organizational power to legitimize it. I rely on my health center sponsors, like the CEO or medical director, who can make it happen. Change agents are the implementation team members who help bring change along to all staff. The employees impacted by the change are called targets. It is certain that many employees will play several roles in the change process. If you think about it, the implementation team members are not only change agents, but are often targets of the change, and they can serve as sponsors to an employee who they supervise. It can get a bit overwhelming, which is why having a trusted team and solid executive level sponsorship is so important.
Expectations.
As an implementation specialist, you can expect that I will do the best I can to meet your needs, commit to doing what it takes to get the job done, respond in a timely manner, respect the perspective of others and support the team's choices, be professional and trustworthy, and share experiences and best practices to help the health center succeed. Implementation specialists have many responsibilities. We must be able to help organizations manage this large project, effectively train users of the system, engage with clients to help answer their questions and concerns, and finally support the health centers remotely when needed. The HITECH Act that was passed has helped fund a health IT education and training program at a nearby community college for me to enhance my skill sets, as I hope to become an implementation manager soon. This is an extensive program that lasts about 6 months. I'll get a certificate at the end. The program is looking to train over 10,000 people. I encourage everyone to check it out.
A heading. EHR Project Manager.
Hello there, everyone. I'm Sandra, and I am the new EHR manager at the health center. I was promoted from the Quality Improvement Department, and I am so excited about this new opportunity. My organization created this role because we have a vested interest in health information technology. My responsibilities include managing the implementation project locally at the health center, bridging communication between our health center control network, our implementation team, and sometimes various HIT vendors, keeping track of the budget to ensure we are appropriately using our funds for the EHR and other technologies, helping the organization address any change management issues, giving status updates to all stakeholders, and carefully monitoring the implementation plan and making sure tasks get completed on time.
A 6-month calendar.
I have come to understand the major milestones for the EHR project. This is a projected timeline of some of the more complex steps in the plan. They include kicking off the project, evaluating clinical workflows and designing them for the certified complete EHR, preloading vital clinical information from the paper records to the electronic chart, setting up the application and interfaces, training users, and preparing for go live. Go-lives can either be set up as a Big Bang theory, meaning that all departments go up on the EHR at the same time, or some sites choose a staged approach, meaning different departments or users start using the EHR at different times. Remember, there is no one approach to managing this initiative.
Implementation agendas.
In addition to managing the task plan, I also create agendas and take notes at the team meetings to document next steps and discussion points. Highlights from these meetings keep the senior leadership team and staff updated on our progress. I know that I can rely on my regional extension center or other health centers in the network for best practices and tips on how to manage this large initiative. This isn't all on my shoulders.
Current state workflows.
A certified complete EHR will have a significant impact on how the clinic functions. The workflows assessment and re-engineering tasks will help us determine how our current processes will change. Our health center has been asked to document all of our processes on how the patient and their chart move through the health center, including how we communicate when the patient is ready for the next care team member, how we handle prescription refill requests and phone calls, and how we track down paper records. This is our chance to look at what is working right and what needs to be improved.
Areas of operation.
To begin the workflows task, our implementation specialist has asked us to define all the steps to register, schedule, and perform an office visit. Other areas we needed to cover were management of walk-in patients, prescription refills, phone call triage, abnormal lab follow-up, referral management, medical records processes, and our billing steps. On the workflows, we have to identify who performs each step, what is being currently documented, and how members of the team communicate. This is a huge undertaking, and it's a good opportunity to get input from our colleagues who are doing the work every day. During the implementation, we want to focus on our opportunities for improvement, as well as preserving those workflows that serve us well.
On a graph, bars are the same height.
Now that we are electronic, I can easily pull data out of the system in real time. I can produce dashboards for the Meaningful Use Initiative that we submit to the government as proof we are using certified complete EHR in a meaningful way. For example, recording vital signs is one core measure of the Meaningful Use program. I can pull reports such as blood pressure to make sure we are meeting this measure. And it looks like we're doing a really good job.
Change management.
I know that this is a big period of transition for my fellow colleagues. Recently, I learned about the future shock concept, which is a point in time when people can no longer assimilate change without displaying dysfunctional behavior. For example, some staff members may cling onto the paper chart and not want to move on to using the EHR due to future shock. Other staff members may become concerned that the EHR will replace their jobs. As a change agent for my organization, I want individuals to feel comfortable coming to me should they have these kinds of concerns. There are many expectations of an EHR project manager. I must be able to support the implementation team and fellow colleagues, work with quick learners of the system to help them grow into super users, and troubleshoot issues in a constructive way. As an EHR project manager, I have to possess several critical skills. I act as a liaison between our health center control network, our vendor, and our users. I help to maintain an up-to-date implementation plan. I provide basic and advanced training to all employees, and I need to be able to run reports for important initiatives such as meaningful use. The data pulled from the Certified Complete EHR determines the amount of incentive payments we receive. While talking with our implementation specialist, I heard about the 6-month training program that the Office of the National Coordinator is providing. Since documenting workflows and transforming them over to the Certified Complete EHR is so important, I am looking into the practice workflow track.
A heading, provider champion.
Hi, I'm Dr. Rita Harper, and I'm a physician on the EHR implementation team. I am the head of the internal medicine department, and I like working with computers, so when I was asked by my CEO to join the team, I thought it was a good fit. As a provider, I bring the voice of the clinical user to the table, making sure our perspective is being heard. I review the current state workflows with our team and help design them for the electronic system. I help train my fellow providers so they understand what and how to document electronically. I ensure our QI vision is being met, and I set up important medication problem lists and orders in our EHR. I also rely on our implementation specialist and EHR manager to assist with many of these functions. We've grown into a pretty tight team. One of the first tasks we were given is preloading. This means taking certain elements from the paper chart and manually keying them into the electronic health record, so we have that information available right on the screen when we start seeing our patients during Go Live. We had to make decisions on exactly what would be entered into the system. Our health center decided that the problem lists, medication lists, allergies, and the last visit's vital signs would go into the chart. For our complex patients, specialist reports would be scanned into the system as well. We were also able to electronically import our historical lab data, which allowed us to take advantage of clinical decision support prompts for diabetes and HIV lab tests that were due, starting right at Go Live. Our EHR manager helped document how our paper workflows or processes would look in the EHR. We then walked through these newly re-engineered workflows to test them. This helped us determine who got what privileges or securities to view certain information in the chart.
Training and Go Live support.
Throughout the training and Go Live support period, I helped the providers use the basics of the charts, all the different templates we would use, and where to put the information, like our chief compliant assessment and plans. Finally, I helped the users understand how we would hand off our charts electronically between providers, nurses, and medical assistants. Many providers had questions about why we were doing something a certain way. I was the voice for the implementation team to discuss how we reached those decisions. 2 weeks before Go Live, we scheduled simulations, meaning we would have one patient in the morning, then another in the afternoon, all on the certified complete EHR. This was great learning for us. During Go Live, I was around our main pod. People would ask me questions about how to document something, and I would take any concerns back to the implementation team.
2 kinds of resistance.
I'm an advocate for change. I can have some influence over the change, but I rely upon my sponsor, my CEO, to actually make the change happen. We learned a lot about change management from our implementation specialist. I learned that resistance occurs when people's expectations are disrupted. Resistance means opposition to the status quo. It can be individual or cultural. Resistance doesn't mean that something is wrong. It means that people can't operate as they expected to or are uncomfortable. I help the team identify where there is resistance, and I try to work with those individuals so they don't feel so uneasy.
2 charts.
Our EHR project manager is being trained to pull certain reports for the Meaningful Use Initiative. Documenting smoking status and smoking cessation are clinical quality measures in the program. I take these dashboards back to our provider meetings to share outcomes data with them. It's great to see data from a total population and not just a small sample size that we used to get out of our paper records. I pull other members of our care team in to review these reports as well, as their work directly impacts the performance of these measures. We talk about opportunities for intervention and ways to proactively reach out to our patients who need to come back to see us. The EHR is a tool for enhancing our ongoing quality improvement efforts. One of the first tasks we completed during our kickoff was to review our quality improvement mission and vision. That serves as our guide to review the clinical templates available to us and create reports that will pull out the information we need. As a provider champion, I am very interested in helping to manage and maintain our EHR in order to meet our QI vision, maintain provider satisfaction, and ultimately improve patient satisfaction.
Skill set.
In order to be a provider champion, I have to be able to effectively communicate the clinician's need to the implementation team. I am currently being trained by my IT team to learn basic troubleshooting techniques, such as identifying what server a user is on or what problem the printers are having. I never thought I would learn this, but it actually makes sense to be able to solve some of these problems quickly. Finally, I train the clinical team on important workflows like electronic prescribing and how to order a test correctly. I'm thinking about joining the Community College Consortia program too, as I know the provider consultants are in demand right now.
A heading, CEO, Roles and Expectations.
Hello, I am Elizabeth and I'm the CEO at the Health Center. Our implementation team has worked very hard over the last several months. I was their leadership support throughout this project. I attended meetings when I could, and I received regular updates from our EHR project manager and our provider champion. Our COO worked with the implementation team to review all of our current policies and procedures and made changes as appropriate to support our EHR. I reviewed and signed off on all of them. I also approved the Certified Complete EHR awareness planning for our staff and our patients. At our all-staff meeting, I shared the goals and the vision of our Certified Complete EHR, and I provided regular updates to the staff. We created flyers informing patients about the EHR and posted them throughout the health center. We even put together a campaign that counted down our go-live date. We had to determine the impact on access and make plans to accommodate patient volume as we reduced our schedules to allow the users time to learn the new system. During the go-live period, I routinely made rounds on the floor to see how our users were coming along. They did great. Since this is the post-go-live period, I'm thinking about forming some focus groups to discuss what we did well and what we can improve upon to prepare for other big initiatives coming our way. As a sponsor of the project, I am the individual who can approve or legitimize the change. As a sponsor, I know I have a number of roles. I have a public role, showing my support of this initiative to patients and to the staff. I also have a private role with my leadership team supporting the same message. The ability to use motivational rewards like free lunches, to minimize logistical hassles like removing paper prescription pads, and establishing consequences, performance improvement plans for stragglers. As a sponsor of this project, I also have the responsibility to monitor actions to ensure that things are running smoothly. I also must have the willingness to sustain support throughout the duration of the change. I am fully committed to this initiative. When I need help, I know I have the support of our network, our regional extension center, and our primary care association.
Implementation team.
I counted on my medical director, the chief operating officer, and the nursing director to make decisions on who would be on the implementation team. We looked at individual skill sets, qualities, and attributes. We needed a group of cross-departmental staff that were capable of achieving a good team dynamic. We have to establish an environment of mutual trust and respect because that is the foundation of building and maintaining an effective team. Clearly, there are times when one individual might represent multiple roles on the team, and our health center controlled network has really been able to assist us along the way as we identify gaps. The team leader must have a good working relationship with both team members and senior leaders to keep all stakeholders informed. He or she must be well organized, be able to identify resource gaps, as well as resolve team conflicts when they arise. The provider champion is identified to work with the team leader. This individual should be a clinical opinion leader in the health center. A nursing representative should be able to keep the department up to speed, understand the capabilities of the system, and be able to train others that are new to the health center or are struggling. We want our medical assistants to be able to provide the current state of how things are running or flowing through the health center. We look to the MA to tell us what is really going on in terms of bottlenecks and where we can improve. Our IT department makes sure we have good connectivity in place and helps procure the equipment such as workstations and laptops. Administration helps us understand the organization's goals for the Certified Complete EHR project and keeps us up to date in terms of upcoming initiatives such as meaningful use. Patient support services includes our front desk and our billing department. What gets entered into a patient's registration not only impacts meaningful use, but it helps us correctly collect copays or bill insurance. Quality improvement and data are key in reviewing our initiatives and identifying what we can easily pull from the system and what fields may need to be created so a report can be run. Since we joined our health center controlled network, we have benefited from significant leadership and support in these areas. Medical records needs to be involved as they will learn a new skill of scanning documents and inputting data into the chart. The Behavioral Health and Case Management Department may also go live at the same time as the other services. We have decided to stagger their go live 8 weeks after primary care goes live. Primary goal is to integrate these often separate charts into one shared medical record.
Transition state.
Effective communication among all team members is the key to success. There must be an understanding that everyone's opinions and ideas are valued. Each team member must own the change and understand why and how this new system will be an improvement. All impacted stakeholders must feel like part of the project and agree to the process and goals. In helping to support the project, it's essential that I understand the common characteristics of change. These characteristics are low stability, emotional stress, high, often undirected energy, control becoming a major issue, past patterns of behavior becoming highly valued, and the rise of conflict. If users are experiencing these, I want them to feel comfortable to discuss what's on their minds. I have seen all of these potential problems arise throughout our implementation and adoption of the certified EHR technology, and my involvement in mitigating these concerns is instrumental to getting buy-in.
Meaningful use.
My ability to review reports with up-to-date data and to be able to track the high quality of care we are providing to our patients is another benefit of this program. We have listed a number of our providers as eligible professionals, meaning that they are incentivized to meet certain measures within the Meaningful Use program. We are thinking through add-on features such as e-prescribing and new technologies like telemedicine that we can purchase. The EHR implementation was a wonderful example of our hardworking employees centering around a common goal to make this initiative go smoothly. I'm so proud of them, and I know your team will be successful too.
Thank you for joining us today. Make sure to check out our other modules on what is health information technology and meaningful use, and maintenance of the Certified Complete Electronic Health Record.
References: AllianceChicago.org, LegacyCommunityHealth.org, healthit.hhs.gov. Brought to you by the U.S. Department of Health and Human Services, Health Resources and Services Administration.